administration, the real question is, why did the government deliver less than the best? We are asked to think or swim with numbers that don't add up, but makes us back up and say, what is this? Mr. Speaker, financial resources are critical to national development. Its availability permits us to undertake and promote varied economic activities, leading to increased production and accelerated economic growth. However, and above all, the Guyanese people certainly deserve to be satisfied that the best economic decisions are made when there is value for money spent. They have the reasonable expectation that there would not be random and risky undertakings and senseless, unsound investments. The Guyanese populace, expect their government to utilize sound and reliable data and be forthcoming and transparent so that they can properly evaluate how taxpayers' monies are being spent. Large budgeted amounts in themselves are neither overwhelming or impressive unless backed by solid plans and reliable strategies. Therefore, an adequate addendum, Honorable Member, Finance Minister, should be probably attached to your narrative. So going forward, it should accompany the document, if the Honorable Member wishes to consider. Mr. Speaker, the Finance Minister, the Honorable Ashley Singh, and his team have sought to identify in Budget 2024 the global and regional economic context, developments in the domestic economy, and the sectoral achievements that would have occurred in 2023. However, the cries and the welfare of the Guyanese people have not been adequately addressed. Mr. Speaker, there was a scholarly attempt to give us a caption which appeared on the surface to be profound, as it reads, "Stay the course, building prosperity for all." Mr. Speaker, a closer look at Budget 2024 would show that the PPP small c government has run off course. In fact, the government has run amok and has built prosperity not for the masses, not for the common people, not for the working class, and certainly not for the small man who ought to be the real man. My colleagues on this side of the divide have convincingly shown, and I concur, that budget under review has been designed for family, friends, the favored, the faithful, the flatterers, and surrounding fawners. The budget focus has not been on national priorities and has been big on infrastructure. I will reiterate that development cannot be defined only by an increase in material wealth, but must include the welfare of the people. Mr. Speaker, Budget 2024 is coming at a time when the territory of the state is threatened by our neighbor to the west, a threat to our maritime zone to annex Guyana's maritime spaces. But as a people, we will continue to be vigilant and to use the judicial process to provide that the tribunal award of 1899 is still binding. And according to David Arthur Granger, this is article Secure Borders, page 7, and I quote, "Venezuela's fear is that once a judicial process could prove that its contention that the arbitral award of 1899 was a nullity was proven to be baseless, its 50-year strategy of attrition aimed at gaining territory from Guyana would collapse," close quote. Mr. Speaker, the Guyanese populace look forward to this beautiful country remaining the ultimate governance of guarantor of peace. Mr. Speaker, Budget 24 is also coming at a time when, from all appearance, the Constitution of the Cooperative Republic of Guyana, the Constitution, it should be sacrosanct and supreme, but that seems to be threatened, as well as the independence of the judiciary. Mr. Speaker, all eyes are opened, and in literary language we call it synecdoche, to the competence of the executive branch, which, as you know, is essential to the viability of the state. May I remind you that the Guyanese populace is looking forward to an election process that is credible and which will include a clean voters list where Guyana, the 10th richest country in the world, with a projected growth 34.3% growth, will utilize the relevant biometrics during the voting process. Mr. Speaker, the senior minister in the office of the president with responsibility for finance, the Honorable Ashley Singh, made us aware on the developments in the domestic economy in 2023, page 10, paragraph 3.1, that on looking at a real gross domestic product, there was growth of 33% overall in 2023, with stronger than expected expansion of 11.7% in non-oil real GDP. On page 23, paragraph 4.1, there's a rapid pace of transformation being realized in every sector in our country. The goodly minister alluded also to the fact that 4% of the budget was from carbon credits, revenues of $150 million US from the first sales contract. On page 25, paragraph 4.9, the minister further reported that with the budget 2024 projects, there would be the deployment of $6.8 billion from the GRIP resources earned under the original LCDs, and a further $43.7 billion to be accrued from sale of carbon credits. Mr. Speaker, please follow the MP. The honorable member is going somewhere. Mr. Speaker, on page 93 at paragraphs 5, 1, 2, and 3, the Minister of Finance reiterated the expansion of the economy at a faster pace in 2024, as the GDP is expected to grow by 34.3%. The Finance Minister noted that the economy will grow at an unusual annual average of 38.8% over the 5-year period. The non-oil is projected to grow by 11.9%, since there continues to be a consistent expansion in all subsectors in agriculture, forestry, fishing, and the construction services, and the recovery of bauxite and gold mining. Mr. Speaker, the honorable member noted on page 94, 3 FPSOs in the Stabroek block will realize 550,000 barrels per day in 2024, with an expected ramp up of over 600,000 barrels per day in the latter part of this year. Mr. Speaker, what I'm saying is that there is adequate fiscal space to pay nurses and healthcare workers. There is enough fiscal space to address in a tangible way the rising cost of living. And there is no lack of money to give a livable wage to public servants, pensioners, the Guyanese or public assistants, and the differently abled. The Honorable Minister Indar, I agree that the poor will always be with us, Matthew 26:11. Please permit me to quote once again from the article Democracy and Development, page 2 from David Granger. The fight against poverty cannot be won through charitable handouts. Neither will trickle-down economies be a panacea for pauperization and privation. Providing jobs, especially for young people, should be a top priority as there is crisis in youth employment. So most of our young people not finding jobs would find it difficult to escape from the poverty cycle. The author continued to note that the war against poverty under a social compact must be characterized not by exclusion, but by inclusionary democracy and an inclusionary process. In other words, there must be not just rhetoric, but real social cohesion, the mobilization of the material and human resources for the very task at hand. Mr. Speaker, the APNU-AFC coalition has always worked assiduously to invest in our Guyanese people's health as we endeavor to mold a healthy nation. It is our wish that the Guyanese populace enjoy good health and well-being, thus fulfilling Sustainable Development Goal number 3. We focus on improving healthcare delivery, access, and cost effectiveness. Lip service is being paid to the extending of universal primary health care to the Guyanese populace. Mr. Speaker, the basic structural and functional unit of public health services is primary health care, the first point of contact for people and families in a continuing health care process, which entails accessible, comprehensive, continuing, coordinated, and people-centered care in the context of family and the community. The public health mantra is healthy people and healthy community. Mr. Speaker, the APNU-AFC coalition wants the government to stay on course as it relates to primary health care, to advocate for the promotion of health and the prevention of disease, to advocate for counseling services and the rollout of relevant programs to drive lifestyle changes, to ensure that there is early diagnosis, early treatment interventions, and care for persons with health problems, and of course, to be able to manage the long-term COVID conditions. Mr. Speaker, we must also turn our attention to managing risk factors, including poor diet, physical inactivity, smoking, the imbibing of alcohol. Chronic diseases. Mr. Speaker, according to the World Health Organization, NCD kills 41 million people globally annually and accounts for 2.2 million people from the Americas. It was noted that people between the ages 30 and 69 years are mostly affected. In Guyana, NCDs account for approximately 70% of our health budget and 68% of our deaths. Cardiovascular disease accounts for 34% of the NCDs, followed by diabetes and mellitus, and cancers, which account for 8%, and the chronic diseases follow along with 3%. Chronic respiratory diseases. Mr. Speaker, cardiovascular disease is increasing in Guyana due to a high-risk burden of poverty and the presence of a higher number of risk factors, as I alluded to, such as high cholesterol, hypertension, diabetes, obesity, physical inactivity, and alcohol misuse. Mr. Speaker, our government in waiting welcomes any approach that will focus on the ramping up of screening of our citizens, that will provide or promote physical activity, increase awareness in healthy eating for optimal health. The Ministry of Public Health will use behavioral change pathway approach and cover the three stages of NCD, namely through lifestyle and prevention, that's primary prevention, detection and monitoring, secondary prevention, and of course, treatment and adherence, tertiary prevention. So primary prevention focuses on lifestyle and prevention through getting people to adopt healthier lifestyles, making it healthier food purchases in the restaurants, in the cafeterias, supermarkets, and engaging in physical activity. We certainly want there to be a paradigm shift to community health, where the people are empowered to take care of their health so that there can be less amputations following the complications of diabetes. Guyana will join the rest of the world and POW's campaign to end cervical cancer so that our women and girls can live long and fulfilling lives. We embrace the human papillomavirus HPV vaccine to help prevent our young girls from being victim of this scourge. And of course, we on this side of divide welcome any allocation, especially of $3.8 million to detect and fight against cervical cancer. Infectious diseases. Mr. Speaker, you must have been aware of the APNU-AFC coalition proactive approach to addressing sudden and unexpected outbreaks of communicable diseases, as we provided more hospital beds, improved protective gear for medical personnel, and better disease surveillance when we commissioned Guyana's first infectious disease hospital to combat the communicable concern of COVID-19. Mr. Speaker, it is our expectation that very soon, filaria, leprosy, Chagas disease, leishmaniasis will be eradicated, including even HIV and tuberculosis by 2030. Malaria is endemic in Region 1, so apart from the distribution of insecticide mosquito nets, there must be continued awareness and maybe edutainment on this subject, as well as the procurement of adequate test kits at the health facilities and labs. Mental health. Due to a paucity of data, Mr. Speaker, the Guyana Newsroom, November 2022, reported that there are approximately 20,000 people battling several mental illnesses. The article further stated that suicide among the country's youth appears to be increasing. Mr. Speaker, though there are satellite clinics in the administrative regions, there has not been any strategy to formalize and to regularize these clinics to offer quality care for our citizens. The Ministry of Health, with its technical partner, PAHO, developed the National Mental Health Plan when we were in government, 2015 to 2020, to address urgent mental health needs. In 2016, with PAHO's technical cooperation, the country developed a roadmap for the introduction of community-based mental health services in Guyana. On evaluating our interventions during our term in office, we got full marks. As the PAHO report found that, as I quote, the country was successful in establishing a governance structure for mental health at the national level, improve health promotion, increase health awareness in community and workplace settings. This article further stated that adequate human resource was built to improve the response capacity of mental health services and provide comprehensive quality care in community-based settings through collaborations with government, ministries, partnerships among government, civil society organizations, CSOs, and health supporting religious organizations, particularly during the early phases of the COVID-19 pandemic. It was noted, Mr. Speaker, there was also a gradual reduction in annual death rate per 100,000 population for suicide during our tenure in office. In terms of support for child and adolescent health, none of the 440 primary or 106 secondary schools have either part-time or full-time mental health professionals presently, and there are no formal school-based activities to promote health and prevent mental disorders. There are no mental health consumer or family associations in Guyana. There are 2 NGOs in the country involved in individual assistance activities such as counseling, housing, supporting groups of persons, and we know them very well, the Salvation Army and I think Phoenix Recovery. We advise that a robust and comprehensive mental health program be rolled out in the prisons, and special provision and security measures also be made at hospitals and clinics where prisoners seek treatment. Additionally, we posit that a correctional mental health conference be done in this regard to assist our prisoners and vulnerable persons to improve their mental health and coping mechanisms. This call is to set up public education and awareness campaigns on mental health. Human resource. More than 300 nurses resigned from GPHC since January 22, September 2022 newsroom. Cultural News. Since January last year, as I quote, more than 300 nurses have resigned from the Georgetown Public Hospital Corporation. The country's primary medical institution has been hard hit by a high number of nurse resignations in recent years. And according to a well-placed source at GPHC, at the end of 2022, close to 250 nurses had resigned from the hospital. By the end of August last year, more than 100 nurses had tendered their resignations from GPHC, another source noted. Last month, online news source reported that some 1,200 nurses should be manning the hospital since it's a 450-bed facility. However, the current staff roster is far below that figure, grossly impacting the ratio of nurses manning the beds at the hospital. Migration to greener pastures seems to be the order of the day, as there's mass exodus of healthcare professionals, as many nurses have been taking up attractive packages offered by healthcare entities in the United Kingdom and the United States. Several nurses who moved to the United Kingdom this year have indicated that the current salaries are double and triple the amount they were paid while working here in Guyana. In addition, the relocation packages offered by foreign hiring firms also cater for the well-being of the nurses' families. The call by this government to address this shortage of nurses by bringing foreigners nurses is unacceptable. The expansion of postgraduate training at GPHC, developing a hybrid nursing program to increase the training of nurses from about 150 to 200 per year to enable the training of 1,000 to 1,500 nurses alone will not cut it. One of my colleagues, Honorable Member Royce Ford, decried in one of his articles the move. Ford noted that the government has failed, as I quote, to improve the working conditions of local healthcare providers, but is ready to import nurses to fill the shortage in the system. Mr. Ford went on to say, the Honorable Member, that the approach by the government to address this extremely worrying shortage could only lead to a further diminished number of nurses, causing a diminution of that important sector of our society, close quote. Nowhere is the government's behavior disheartening when it appealed a recent decision of the court, which granted nurses compensation for days undergoing industrial action. This government has no respect for the judiciary and certainly no respect for the nurses. They are not on the side of our healthcare workers. Capacity and infrastructure, facilities, equipment, and drugs. Mr. Speaker, the PPPC has given us in the budget a narrative a plethora of health facilities that will either be upgraded or expanded throughout the country with the aim of improving health service delivery to the Guyanese populace. Mr. Speaker, the government boasts of some $10.3 billion for the construction of pediatric and maternal hospital in Ogle, a $6.2 billion hospital at New Amsterdam, construction of regional hospitals in their strongholds to the tune of $15.5 million, the upgrading of hospitals at Baitika, Saudi, West Demerara, and Cameron, Cato, Maruka to a tune of 10 million and 1.5 billion, 10 billion and 1.5 billion respectively. Let us sensibly ask ourselves where human resources would come from, where the human resources will come from to ensure that these spendings improve the health services deserving of our people. Development must be coordinated and integrated, and it's more than showing of monies at our problems or wishful thinking. The annual Auditor General's report, as we look at modernization of the primary health care, on paragraph 445, it says, on 19th of July, a memorandum of understanding was signed between the government and the Cooperative Republic of Guyana at Exim Bank of India. The bank agreed to provide the government with an aggregated sum of $17.5 million for financing the upgrade of 3 regional hospitals. The sum of $450 million was allocated in 2022 for the design, rehabilitation, and construction of primary healthcare facilities as West Demerara and Baitika regional hospitals. Amounts totaling $47.778 million were expended from the $450 million, leaving a balance of $402.22 million. As a result, the ministry was unable to fully achieve the intended benefits of enhanced healthcare delivery and improved health facilities. Of course, the ministry will respond by saying that the sum for the $7.778 million was expended on consultancy fees, and the remaining balance was unspent due to a change in project scope that resulted in delay. Mr. Speaker, having improved infrastructure is commendable, but without adequate nurses and doctors to fill those hospitals, citizens will find themselves not better off, but worse off. In emergency situations, we cannot afford to have citizens rushing to hospitals which do not have the personnel to assist them. That is both a waste of money and a recipe for disaster. Each hospital must be adequately staffed to meet the needs of community it serves. Mr. Speaker, we recognize that building new hospitals increases access to care, but that assumes that there are adequate nurses and doctors to administer that care. We know that Guyana has been going through a personnel crisis with nurses and doctors leaving in droves. Failing to acknowledge the root cause of this crisis, which is a need for competitive wages, the government has imprudently announced 6 new hospital projects. Drugs and medical supplies. December 31, 2023, the CEO of the Georgian Hospital has stated that while 2023 saw numerous challenges, the hospital made strides in healthcare delivery, and these challenges were not limited to staff shortages, but include infrastructure, unavailability of beds, and supply chain issues such as delivery of equipment. And as I'm in drugs, someone called me just the other day and said, okay, simple glycoside. Glycoside is one of our drugs that we use to manage or treat, we should say, diabetes mellitus. And when the patient went to our government facility, our pharmacy, it was nil. But let's call him patient B, went to one of the hospitals, a private hospital, which is very known to all of us. He was successful in collecting and receiving the required medication. So not at the public pharmacy, but at a private pharmacy, which is known to almost everyone. As I'm on drugs and supplies, 16 billion was given to, let's say, Brother B, to provide pharmaceutical last year. But why not that money split to the other business persons? Why one particular person, Madam Chair? Capital purchases, equipment. The Auditor General also spoke on paragraph 449 that the sum of $937.391 million was expended to procure medical equipment, which included portable ultrasound, medical refrigerator, treadmill, and computerized radiographer scanners. A physical inspection in August 2023 revealed that suppliers failed to deliver equipment valued at $465.35 million. In September 2023, the ministry submitted stores received and delivered notes for equipment valued at $138.692 million. The recommendation from the Auditor General office, he says that try to monitor each contract to ensure strict compliance with contractual terms and ensure all outstanding equipment are received. Maternal child health. Mr. Speaker, every child deserves to have a healthy start in life, and every mother should have access to quality care. The first 1,000 days of a child is very important. Mr. Speaker, the nurses are well positioned to have a positive impact on maternal health. With advanced education of healthcare personnel, the giving of relevant incentives to midwives, and addressing the socioeconomic and structural maternal health factors, such as income inequality, shortages of healthcare providers, and lack of paid family leave, those should be considered. It's about time that the fathers play a more pivotal role in the growth and development of their children. Hence, the obstetric ward must be father-friendly to ensure that they too bond with the child as they seek visits to the wards. Mr. Speaker, I look forward with great expectation at school health programs and policies that it will take a front seat in 2024. The continuous training of nannies could help in reducing the maternal and infant mortality, the latter being the tells us about life expectancy of our country. Guyana, in addition, Mr. Speaker, we're expecting that government redoubles its efforts, I should say, to reach the Sustainable Development Goals, at least SDG 1 and 2, by 2030, to reduce inequalities between the coastland and the hinterland, and to ensure that no single Guyanese is left behind. Mr. Speaker, as I conclude, I want to say that the $1 trillion budget.
In order to conclude, you need an extension.
Thank you. Madam Speaker, I move that the honourable member will be given 5 minutes to conclude her presentation.
Granted. Go ahead, honourable member.
Thank you very much. Thank you very much. Mr. Speaker, as I conclude, I will say that this $1 trillion budget, with so much fiscal space, is not stimulating or people-centered. It is anti-Guyanese. It is an intergenerational injustice and a moral failure. Mr. Speaker, the country expects more in 2024. But what we are told amounts to a really bad cold. The negative impact of this budget is only contagious. It is full of pus and not for us. The Guyana has the fastest growing rate, but a closed gate for young aspiring owners. How to get the capital needed to create wealth for indigenous Guyanese is an issue that the government is happy about. I cannot support 2024, budget 2024, Mr. Speaker. At least in its current form, as is, unless an amendment is made to reflect the good life that the Guyanese of all walks of life, of all classes, of all creeds, should begin to enjoy now. As one author from an article entitled "The Catalyst" remarked, making a choice today to benefit families, friends, favorites, the flatterers, and the fawners at the expense of our children and grandchildren is ludicrous as it is ridiculous and gives us on this side of the divide much political pain. I thank you, Mr. Speaker.
Thank you, Honorable Member. I now call on the Honorable Minister of Health, Dr. Frank Anthony.